Hello, everybody. How is everybody doing? Who's in this chat? Let's see. Anyone here? Oh, 10 people are here. Thank you, guys. I know it's a Saturday night. I'm sure everyone has fun plans tonight, but you're spending some of it with me, so I appreciate that very much. We'll jump into this soon. Chat publicly. Okay. Turned on subscribers only mode. Only channel subscribers can send messages. Oh, okay. I guess Marco set it up that way. Let me message him. Did he mean to do that? Subscriber only mode? Let's see what Marco says. Did you mean to turn on subscriber only mode? Yeah, Marco, switch to everybody. Hi, guys. Hi, Marcel. Hi, Josu. Nayari. How are you guys? We're going to switch. I'm watching the stream. Okay, Marco, can you switch it? Hi, Vitamin Z. Yes, Marcel's right. Everyone should be subscribed, but we'll try to open this chat up to everybody because maybe some people are still on the fence. I don't know. Finally, I caught alive. Great, Kylo. That's awesome. Liz NYC, I know who you are. So we're doing this fundraiser for the Leukemia and Lymphoma Society. Someone very near and dear and very, very, very close to me has leukemia, and you'd never know. It's like the silent disease that you don't look like. I look like more of the cancer patient. You don't really look like a cancer patient necessarily when you have different forms of leukemia and lymphoma or other types of cancers as well. However, these are folks that are very brave. They're on treatment. Person who I'm referring to specifically is on a chemo pill every day, and it's not easy living with that. And also, there are some folks who undergo intensive treatment for their leukemia and or lymphoma, and they then lose their hair, usually temporarily, but that can happen. So hi, Cynthia. And so that's why we're doing this fundraiser. Hopefully you guys can give some money to their charity, and and all the monies collected for this live go to them. So great. Thanks, Marco. I like the wrench there. He's the fixer-upper. Thanks for doing that. Yes, Kylo, everyone sub right now. Yeah, we're growing this thing. I'm thinking that in 2022, we can get to 1 million. We have some fun collaborations coming up. I can name a few if you guys want. Luxaria is one. Another one is Cassandra Bankson. We've got Jackie. What's Jackie's channel again? It's E-Crafter, Jackie? Nerd E-Crafter. So we have a few. April, yes, I perform rhinoplasty. You should check out our rhinoplasty model video. Just put in rhinoplasty model, and you'll see it's not an actual like a supermodel. It's a modeling of how rhinoplasty is done, and so we go into a lot of detail about different elements of rhinoplasty, different grafting techniques, how the bridge is addressed, how the tip is addressed, and I do this stuff in real life. And we have more showcases for you guys coming up that are gonna feature and highlight facelifts, rhinoplasty. We just recorded a hairline lowering surgery, so not a transplant, but an actual surgical hairline advancement that actually went super smooth. I hope the patient heals well, but I did it on Thursday, and there was like almost no bleeding, which was insane for that type of surgery. So it made everything go very smoothly. And there was it was a great case, and we had it recorded. So we'll be doing that type of showcase for you as well. Lots of planned videos. We've been a little bit slow in putting stuff out the last maybe week to 2 weeks, but we'll be back at it soon. And Yeah, so lots going on. So let's see. Bay Doc, my cousin died of C. diff after his first round of chemo for Hodgkin's lymphoma. I'm sorry to hear that at age 28. Yeah, yeah, no, of course. Yeah, it's an important charity, and lots of people have been affected by it. I'm sorry to hear about your cousin. Um, let's see. Luxaria, yes, Marcel. We are going to be doing a fun collaboration with her. Can you talk about cutis verticus gyrata? It's not something I see often or get to treat too often. It's pretty rare. Uh, it doesn't come up too frequently. There are surgeries for it. When I get a good case, I'll make sure to record it for you guys to see. Who else? What do we have here? Considering a rhinoplasty, but there's not many reviews on the surgeons near me. Any advice? Well, I mean, you definitely want to go to someone who's like well respected for that type of surgery. And so if you're not finding it locally, you might want to look elsewhere and look around. There's plenty of people, in the States and elsewhere who perform rhinoplasty well. Ohio in the house. Thank you. Thanks, Smurfette, for joining. Best which is the longest lasting filler for wrinkles? They all last about the same amount of time. The average is about 9 months. Depends on the location and the filler used to some degree. But you don't want to use a longer lasting filler per se if it's in an area that's very sensitive, because then you'll have it there for a long time, even if it doesn't look good initially or ends up not looking good. So in a way, shorter lasting things are not necessarily bad, because if you're not happy with it, goes away, or you can easily dissolve it. So, for example, you don't want to use a very high G prime filler like a Restylane Lift in the lips, even though maybe it'll last longer, but it'll give an unnatural type of look. You got to be careful with that. And then there are some fillers that are not HA based; they're not hyaluronic acid fillers. There's, say, Radiesse, which is calcium hydroxyapatite, and those fillers will just kind of linger around forever and potentially cause problems over time. So you might get a permanent filler, but doesn't mean you're going to have a permanently great result. Thank you, Yawns. I'm getting a hair transplant next year. I'm wondering if I can fly the day after. Yeah, patients who fly in to see us for hair transplants, they'll fly out usually the next day after surgery. Thanks, Liz, for the donation. That's awesome. Hey everyone, nice, Toronto. So I actually checked out some chairs that are Canadian based today. Found a company I really like, and I plan on getting a nice, comfortable, like office type chair from them, Life Forms, and they're based out of Canada. So nice, Maggie. Thanks for loving the videos. What's your opinion of Kenalog injections? Well, it depends what you're doing them for. I mean, sometimes we do it for recovery from a rhinoplasty if there's still a lot of swelling. Sometimes if a scar is raised, Kenalog is great to flatten it out. But remember, Kenalog can atrophy natural tissue, like normal tissue. So you have to be really careful with that. You can get, especially in the subcutaneous space, you can get like a divoting of that area, and that then you're chasing another problem. So you have to be careful not to overdo it with Kenalog. And there are also different concentrations of Kenalog. There's like Kenalog 10, Kenalog 40. 40 is going to be a higher concentration, and so usually I don't use that unless the Kenalog 10 hasn't been working. And you usually give it a couple of months in between treatments. You don't want to be treating with Kenalog too often. It will linger and continue to work in the body for about 2 months, or in that location where you've injected it. And there are some systemic absorption concerns as well, so you just have to be careful with it. Do you do removal? Yeah, for cutis verticus gyrata. Yes, sometimes, but that's not a very common condition. Should someone not being double board certified scare me away? Is it bad for them to only be single board certified? No, they shouldn't. No, you don't need to find someone double boarded. First of all, you have to know what their board certification is in. It has to be relevant to what procedure you want. And so, no, you don't need 2 boards. You just need at least one relevant board to the procedure that you're interested in. Where did the donate button go? Marco, fixed it? Oh, he addressed it. Okay, good. Thank you, Anonymous, for the donation. It's really nice. Right above the chat. Okay. Clicked on it. It is at the top. Have you ever fixed botched hair transplants? Yeah, I mean, of course, we have revision cases coming through all the time. In any hair transplant clinic, you see a lot of work that maybe people aren't in love with. I don't really love the word botched, to be honest with you. The reason is because I think most surgeons who operate, they mean well. Most are pretty well trained for what it is that they're doing. And there are different reasons for why a surgery might not result in the outcome that you've wanted or that a patient wants. One reason is maybe the surgeon effed up, right? Just, didn't do a good job, poor training, had a bad day, whatever it might be. But I think that that's not the most common reason for a bad result. Um, there is how patients take care of the area or the surgical site afterwards. And not everyone follows instructions. I can tell you that from experience. And that also impacts, depending on the surgery, quite heavily on outcome. Imagine a hair transplant where you give a patient instructions on what to do and what not to do. And then, day after surgery, they forgot or they didn't read the instructions and they just start sort of, kind of combing their hair. They can literally rub off a ton of grafts onto their hand and then they're lost, right? So then they can come back and say, oh, things didn't grow out. So that's an issue. There's just one example. And then there's also just how patients heal. And when we do surgery, you cannot control every last bit of the healing process, neither can the patient. So let's just assume that the patient and the doctor did their best, right? And they did a good job with the surgery, with the post-op care. Then there's the element, the unpredictable of how the body heals. And like, let's say we're dealing with the nose, cartilage has memory, so we know it can bounce back and deviate over time in some people. Hair, for different reasons, sometimes doesn't grow in as well. Sometimes the hair that you're using from the donor area is quite thin, and so then it doesn't look that full in the recipient area. Whereas for someone else with much thicker hair, the result can be a lot more significant and impactful. So, botched, it's a loaded term. It's basically putting the blame on the doctor, and I don't think that's always the case. Of course, there are times when that is the case, but just to kind of harp on one word. But it's more nuanced. Everything in general is a lot more nuanced than how people like to talk about it. What else? Let's see here. What should be done first, Botox or microneedling, and how much time in between? See, Riley, it depends what you're doing all this for. I mean, Botox and microneedling have different indications. They're not really used for the same thing. So if you're dealing with wrinkles and you're doing Botox to paralyze the muscle to reduce dynamic wrinkles, that you can do that. Microneedling might help a little bit with static wrinkles that the Botox won't fix. And if that's what you're referring to, you can do microneedling within a few days of Botox. I wouldn't do it on the same day, but you can do it maybe a day or two apart. Massey, thank you. Glad to donate. Thank you, Marty. My aunt passed. I'm so sorry to hear that. Yeah, it's really terrible disease. Let's see. Can 5-alpha reductase blockers turn hair follicles, which, due to the effects of menstruation, now only spawn a single hair, back into healthy ones? Yeah, sort of. So it's not going to turn a follicular unit that has a single hair graft into one that has 3 or 4, but it can turn or move the hair away from that miniaturized villus state to a more terminal state. That's kind of a more technical answer, but in some ways that can happen in some ways. Do you recommend going to Turkey for hair transplant? I heard it's cheap, but very good. Well, it depends where in Turkey you go, and so there are some clinics that are reputable and some that are not. So just going to Turkey for hair transplant does not guarantee you a great result. I have a lot of patients who've gone to Turkey and have regretted it, and then they end up with me with few options on what can be done for repair. Because if you have one big mega session of 5,000 grafts and those grafts happen to not grow well, and the back looks like a hot mess with scarring throughout the entire donor area, it's you're coming to me for body hair, and we can't really create the impact of what you could have had you not had one of these mega sessions. So I'm not saying mega sessions are always bad, but there are plenty of people in Turkey who try to do mega sessions and they end up with problems. So it's not like Turkey is good or bad. It's just, again, more nuanced. There are some good clinics, there are some not so good clinics. Same goes for anywhere. Hi from again Ottawa, Canada. Thank you for joining. I'm trying to do a good job of reading these comments, but they jump down. All right. Hope you are safe in America. Thank you. Myself, my family, we're doing okay. Thanks. Good question. C. Riley, can you do facial cupping after fillers? I wouldn't do it right away. It takes a few days for the filler to kind of settle in, for swelling to go down from the filler injection. You might have bruising, and if you do the facial cupping right away, you won't know, what caused it, or it's going to just potentially exacerbate the swelling and bruising. So I would wait a week, ideally. Are you familiar with Dr. Sharon Keene's work? No, not off the top of my head. What are your thoughts on the Barbie nose famously done in Turkey? You mean like Love Cove, where it's sort of just very caved in and swooped up kind of thing? Like maybe that's what you're talking about, Barbie nose. Um, yeah, there are places like in LA that I think is still one potential type of nose that people seem to like. And you really are taking away a lot of cartilage and a lot of bone with that type of surgery, and you're kind of scooping out the nose, or you're leaving the patient with one form of a saddle nose deformity that could have ramifications on breathing. So I don't offer that type of surgery because I'm always thinking about functional. Because one thought I had was to do a reaction video to this guy who calls himself the Black Alien. Basically, he's had a lot of body mods done over the years, and he looks like something, I guess, from a comic book. Um, but being head and neck surgeon first and foremost, and caring about the functional elements of how the face works, I have a lot of problems because I was thinking like, well, like he's doing it to feel good about himself. At least that's what he says in the interviews. So how is that any different from the surgeries that I do? People then feel better about themselves oftentimes, and you're doing something elective. But I think the biggest difference is that with my surgeries and with the way we're formally trained, you want to make sure that you're preserving function. You're never compromising on that. So to remove someone's ear because they just want that to look a certain way is really not trying to maintain their function, because the ear has a functional purpose. Same with the nose. So I never want to do something cosmetic that would compromise on function, on the ability to breathe well through your nose. So that's a long answer for you, Love Cove. Thanks, Byzantine. Thank you so much. Hope you're doing well as well. Natalia, thanks for coming back. C. Riley, my pleasure. And Don, hi there. Are there particular kinds of face and hair products that are proven effective for anti-aging? It's a whole separate topic. Yeah, truth from marketing hype. I don't think I'm like the best for the for hair products maybe, but there's just so much on the market, and I think there are some dermatologists, at least when it comes to like skin products, skincare stuff. They do a better job than me at analyzing them and figuring out. There are a few channels that focus exclusively on that. Hair products, I mean, most of the time they're completely unproven. So it's just a company that decides there's some, natural ingredients that maybe have been associated with increased hair growth. They just throw them into a mix and make it into a shampoo and start selling it. But very rarely is it substantiated with actual data. And so that's why I don't really talk about it too much, because it's like, anyone can do it. And hell, maybe one day I'll have a hair product line or some crap like that. But it's really just to sell products. It's not at that point to truly do something that like helps people in the sense of like getting to the underlying biology of, for example, hair restoration. So they're kind of just unsubstantiated claims most of the times with these hair products. And so that's not like they're probably not going to hurt you, but can we really say that there's a direct link to rebuilding your hair? Oftentimes that's not the case. My father was 62 before he started showing signs of thinning, blonde hair. My mother has thick hair. Is there anything I can do at 28 to keep my hair as long as possible? Well, there are a lot of videos we put out on non-surgical hair restoration, and we have one coming out hopefully tomorrow, if Marco and I can get it out. It's filmed and most of the editing is done. It's on laser light therapy. And I know you guys have been waiting on that one. So we did a deep dive into laser light and is it useful, is it not? And so we'll have that one out. But I would just recommend that you watch our other videos to have a good sense of clinically proven things that work in one form or another. That should help you. Marcel, thanks for the donation. That's very nice. Yi Hoto Matak, Mahak, what is your favorite part about your job? Um, well, there's many things. I don't think there's one favorite, like most favorite part. It's really, I think like it's having the flexibility really to do the procedures that I want to do. Because when you're in like a group practice or hospital setting, unless you're like really senior, it takes many years to kind of get up there where you're only doing like a specific type of surgery or things that you really want to do. In private practice, you're in control of that. So if there's something I don't like doing or something I want to do less of or more of, you can steer your career in that direction. So that has been really awesome. And the idea of having a lot of med school debt ever make you consider your career path? Um, I don't know. I mean, everyone finishes of med school with some degree of debt for the most part, and eventually, you pay it off. It might take 30 years, but you can still get a mortgage for a home. You can still do a lot of things. So it's just something that we expect, especially in the United States, as we finish up medical school, to just have debt that we're going to have to repay. So that isn't what drove my career choices. It was more based on just genuine interest in the anatomy of the head and neck, and then ultimately the artistic elements of plastics and combining that facial plastics and then hair became another interest along the way. And then being able to combine all that has been really rewarding. Don, 45, should I get a facelift? I mean, there's a lot to unwrap there. We'd have to at least see pictures of you and talk about your goals. But 45 is not necessarily too young for a facelift, but there's a lot of things to consider. And so we can't just answer that from that simple question. What's your opinion on filler for the lips? Well, you guys know I do a lot of lip lift surgery. So some people ask, well, do you even do filler? Do you hate filler? I don't hate filler. I just think that it has a place, just like surgery has its place in the armamentarium for lip augmentation. So I still offer it. Our weights are kind of like getting a little ridiculous right now for the practice. So a lot of people don't want to wait if they're just getting filler, even though I think filler can be done well, it can be done poorly, and it can have some long-term ramifications. So yeah, what Ella's saying here about how it looks over time, that is a real risk. And I've never seen anyone who's done it for years that looks natural. Yeah, there's a lot of truth to that. So that's why it has to be weighed. The pros have to be weighed against the cons. Let me see. Did I skip ahead of a lot of things here? Lots of questions. This is great. I'm trying to take questions from people who haven't asked any yet. Ajithan, do you think it's worth it to battle hair loss if you're in the beginning of the process? Listen, that's a personal, very personal decision. There's like Harry from Bald Cafe. He has a channel where people just post their stories about how they decided to shave it all off. More power to you or to those people. I mean, that's one way to go. That's an option, you know. I think people just have to like look deep into themselves and decide what makes sense for them. Battling hair loss isn't for everybody, but for most people have androgenic alopecia, and it is treatable to some degree with medicines, with surgery. So, people have a choice. They can do nothing. They can shave it. They can do certain medical therapies and or surgery to try to restore the hair. So everyone has to kind of decide for themselves. Natalia, what made you change ENT for plastics? Well, it's not really a change. It's kind of like, I did the general training, and then facial plastics was always part of the training for ENT. So I was exposed to it from day one in my ENT program. It just became the focus. So I decided to subspecialize. Some people are general ENTs, which is great. They do a little bit of everything. And then when things get complicated in any one subfield, like deep ear surgery, like skull base, sinus nasal surgery, there are very specific, high level surgeries in every sub area of ENT. So when it gets really detailed, then you send out to like a subspecialist, right? So that's how it works. And so I decided to subspecialize in facial plastic surgery. And then some ENTs will still do a lot of ENT, and they'll do some facial plastics even after a fellowship in facial plastics. My route was a little different. I did facial plastics, and then I did more training in hair. And that then became the focus of my private practice. And as you guys know, I'm still at the VA hospital doing some basic ENT for veterans. I am going down on that time in the new year because my practice has picked up. I think we're scheduling consultations now into the end of May, end of May, June. So 6 months for just a consultation. So it's, we're trying to like fit more people into the schedule. So if I'm away from the practice more, obviously that makes it challenging. So I'm going down to just 1 day a week at the hospital in the new year. So that will allow me to be there for my patients in the practice. But it's not an easy decision. I enjoy ENT. I enjoy working with vets. And so that was a big decision for me. But we decided in the new year that would be the right thing to do. Love Cove, you're welcome. Faye, thank you so much. Don, Michigan here, great, thank you. Adjuthan, I get it. The whole process of losing hair is a headache. Let's see, Pippi. What do you think of Tracy and Darcy's the Silva twins last surgery? Oh, I don't know who they are. I'm sorry. Their faces look bloated now. Why is that? I'd have to evaluate those photos and the results. Sometimes I'm finding, and I have no idea if this was the case with them, but more and more people are doing a lot of fat transfer. So, like BBLs, right, for the butts. But for the face, people are taking fat and moving it to the face too. That can lead to a fairly bloated type of look, especially over time. So I don't know. I don't know anything about them. Maybe they didn't get that, but that is something that's becoming more popular. Will the hair ever grow back if you have alopecia? It depends on the type of alopecia. It really does. That's a general question. It gets really, really specific there about the type of alopecia, how long it's been there. Some alopecia's hair can return. With the most common type, androgenic alopecia, usually doesn't return very well without some treatment to get it back. Thank you for your honesty. That's what I do. Always honest, but you're welcome. It's truly the wild, wild west for products. Yeah, I agree. It is. And if I ever get into products, I'll try to be as straightforward as possible about like the reason for each ingredient and the data behind that. But it is really hard to do clinical studies on like shampoos that have lots of ingredients, because it's hard to pinpoint which ingredient is really doing the work. Kat, is it a good idea to travel to a different state for a facelift? People do travel, say to me and to others for out of state surgery. The general recommendation is to be in that or right around that office for a week, just to make sure nothing bad happened. I mean, that is a surgery that carries more risks than some others, especially certain types of bleeding risks. And so you do want to be around, like you don't want to go to a doctor who says, yeah, you can fly home the next day after your facelift. Like that's not good clinical care. In my opinion, it's not safe care. So you'll probably want to stay for a week. But otherwise, it's not a bad idea if you found someone who you trust and you think can do a good job. Have you heard? Lucas is asking if I've heard of Regenera Activa stem cell therapy. So yeah, I'll be doing a video eventually on stem cell therapy on exosomes, specifically for hair restoration. That is the wild, wild west right now, and there are no FDA-approved therapies. There's so many different types of sources of cells that people are using, so there's potential for a lot of harm and danger in that. There's also potential for a lot of good, because we know growth factors such as what is in exosomes can be very beneficial. So can stem cell therapy. So it's about figuring out a way to deliver it safely and reliably. But I don't know about that specific company. Okay. Do you watch the Bald Cafe channel? I've only seen a few short clips. I don't watch it regularly, no. We've asked Harry to collaborate, and I don't know. He seemed maybe to have a little bit of interest, but then became a bit distant about that idea, and has been hard to pin down for any real collaboration. But I thought it would be interesting to chat with him. Smurfette, yes, laser light. It is coming soon, hopefully tomorrow. Heidi, thank you so much for the donation. That's really, really nice. Thank you. Leon, I wanted to answer a Leon question and then it skipped ahead.
I have
There's so many others. All Pro. Oh, Leon here. How often do hair surgeons look and diagnose for other conditions of hair loss? A friend had bad hair loss due to thyroid issues, but is on medication now and restored. He looked into Yeah, I mean, I think it's important to think about other, potential causes. Most of the time when we do the blood work and we do the analysis, it comes back as everything is normal. So only if I'm seeing a pattern that's like very off and I'm worried about scarring alopecias or something unusual, or the eyebrows are really thin, and I'm thinking there could be like a thyroid issue, or something that doesn't look routine, I definitely will get more of an analysis, sometimes a biopsy even, before going down the surgical route. All Pro, do you know the amount of liability doctors had before you started med school? The amount of liability doctors had. Well, there's always been some liability. I don't know if you're referring to specific like numbers for like malpractice insurance type of liability, but it's always been there. But yeah, I'm not sure exactly what he's referring to. Do you paint? I did. I do, but I don't have time. I'll just draw with my daughter these days, and as she maybe gets into painting, I'll do it with her. But I'm pretty swamped, as you can probably tell, with clinical care and like all this YouTube stuff, and my family, just keeping up with the basic stuff. I wish I had more time to paint. One day, maybe I'll carve out time for it, but I'm also in a New York City apartment. It's not like I have a whole studio here that I could create. So I'd love to do it more. I used to paint more. What do you think Ariana Grande had done for her face? Yeah, she had a number of procedures, and that's definitely one that's on our list to cover, that reaction to Ariana Grande's facial work. Yeah, we're gonna try to incorporate celebrity stuff more regularly. People keep asking us for it. B, it does well on YouTube in our experience. And yeah, so I think it's gonna be something that we start doing a little bit more regularly. To be honest with you, I don't enjoy it as much as I do just talking about topics that interest me that I think are important to talk about. But usually, having a celebrity there will attract attention, and then we can still cover a lot of interesting points, um, and still teach and have people take something away from it. But in general, I don't really care too much for celebrities. So, but a lot of people do, and so we understand that. So we're gonna keep giving that to you guys. Um, Oh, he's asking someone else. Jawline implants or fillers for men? I don't love implants other than like some chin implants. Those are very confined and easier to work with. When you're doing like full custom mandibular implants that extend all the way, or like complex cheek implants, they just over time they don't look that great. And even initially people have, concerns about them. So um, I don't find the satisfaction level to be that high. And that's one of the main reasons why I don't do it. Fillers for men, yeah, sure. Depends on, again, the location, the indication, what their goals are, but it could work. There's no reason why you can't do fillers for men. Steve, you look so good. Have you had any No, I appreciate that. Not everyone thinks that, but I am, yeah, thank you. I have not had any facial plastic surgery. I haven't even had filler or Botox. I've considered some Botox maybe as this line gets a little more annoying. But I don't know. I have pretty good skin genetically, I think, and I really haven't. People think I had a lip lift for some reason because I, I have like a fuller upper lip. That's inherited as well. Um, but uh, but I appreciate those kind words. Let me see. Hello, no name. Hello. Why don't you use a name? No name. Would that be? There's like people talking to each other, which is interesting. Can I ask questions about fat transfer? Yeah, go ahead. Ask a question. ENT, that's amazing, blah, blah, blah. Do people ever get hair donations for hair transplants? So it's a good question. It comes up a lot. Well, here's the thing. So if you take hair from someone else's head and put it on your head, your body's going to reject that hair because it has different genetics. It's going to see it as foreign. It's just going to attack it and destroy it, and the hair won't grow. If you were on immunosuppressant medications, like if you had, say, a kidney transplant and then you got on some suppressive meds, then potentially the hair could still grow. But I don't know of anyone who's tried it that way. I mean, m- I don't know if someone who has a kidney transplant, if they really prioritize their hair still, or if they're just happy to be alive. But I haven't heard of that scenario. But I think there is that specific type of case where maybe it could work. However, that is very rare. So for just anyone coming in wanting hair taken from someone else, it's an absolute no. It just won't work. The veterans need you. Yes, thank you. I think we do help them quite a bit. My lymphocytes have been high, Adrian says, since 2013 due to being on MS med. I will be starting a crevice. Is there any way to bring down my lymphocytes? I am not a professional in lymphocyte management. So this fundraiser is for leukemia and lymphoma. However, and that's because someone near and dear to me has leukemia, and we want to raise awareness for it. And plus, there are some hair loss, types of crossovers for cancer patients. But I'm not a pro when it comes to lymphocytes and that like bloodborne disorders. So I'm not the right person to ask. Do you find it hard to balance work and family time? Any tips? Yeah, I mean, it's hard. Of course, it's definitely hard. Recently, my wife came down on me for weekends and doing too many weekends, and so she instituted a new rule. uh, which is one weekend day a month starting in February. So we're going to try to stick to that. But I think it's just having the right support at home. You have to be on the same page, but also someone who can put you in your place when you're maybe going too far. Because, like especially with the type of work that I do, it's very exciting. It's and when you see the growth that we've seen over the last year, whatever, say 6 8 months, about a year of like really steady growth, you want to be there to take on all the new interest and help people, but there's a point where you say I'm only one person, and I have to kind of like space things out and be um, slow and steady with the growth in some ways, like kind of slow things down, because you can burn out. I mean, for sure. I was just telling my wife today, like last weekend I did a hair transplant Saturday, and I did one on Sunday, and then I had a string of other surgeries throughout the week, and this weekend I'm off. But well, we're doing this, but this is just fun for me. I don't really think of it as work, but still. But yesterday I was exhausted. We had our holiday party yesterday. You guys may have seen a little. If you go on my Instagram at Dr. Gary NYC, if you guys don't know about our Instagram, check it out. We post before and afters, and we post some personal stuff as well. But if you go to stories, you'll see my team, or at least most of the members of the team. Marco is not in the picture, unfortunately, but he will be, I think, in the next year's picture, which is exciting. So yeah, but you'll see my team, and so I was just like exhausted at the end of yesterday, because it's like you're just going nonstop. So you have to take breaks, you have to give time to the family, very important. But there's a way to kind of blend it where it's a little bit more seamless. But yeah, Jenny, thanks for the donation. We're at over $100. That's awesome. That's great. Let's keep it going for Leukemia and Lymphoma Society. Can a person with a hyper upper lip and very gummy smile get a lip lift? Asking for myself. I appreciate the honesty, Carmen. Gummy smile, the gummy smile element of it isn't so much a problem as long as at rest, when you open up your mouth, you do this. As long as you're not seeing gum, it's usually fine to still do a lip lift. You have to kind of like not get an aggressive lift that it can potentially cause problems and make things look worse. But if it's customized properly, it can still help in many cases. But yeah, but it is tough when you have someone with a really long philtrum and they have like almost full dental exposure, almost up to gum at rest, like when they open up their mouth like this, and then, so they want this shortened, but their teeth are too exposed. So those patients are actually, in my opinion, not good candidates, but those are like extremes. Most of the time, you can still make it work. I just saw a case where a vein on the forehead was blocked with filler. Nasty. Well, there are sclerosing therapies for veins. So some people are bothered by veins, not just on the face, but also other parts of the body. And there's different types of like lasers and things that can zap it from the inside to like destroy the vein. And there's also like a thing you can inject, the sclerosing type of agent. It's not necessarily filler the way you think of filler as like being hyaluronic acid, usually based filler for adding volume to the face. That's different than a sclerosing agent. So if they were showing that, like say on an IG, my guess is it was probably a sclerosing agent to try to get rid of a facial vein. I doubt they would show HA filler going into a vein because that wouldn't be the best thing to show. Anonymous, thanks for the donation. We're getting some others from Jay Leia. Thank you so much. That is awesome. Let me see here. I'm trying to go back up because there's like lots of good questions. Have you ever removed a fat graft? Fat graft from where, Melody? From the lip or from just anywhere? Fat is sometimes hard to remove. Oftentimes it's injected as just like small little chunks of fat as opposed to an actual solid graft of fat. Either way, it can be hard to like just take out the fat. But there are times when you can surgically excise like a fat if it's just built up in one area. You can go in and remove it. David, love your channel. Thank you. What are your thoughts on people going to Turkey? Yeah, we have a video on that, and also I mentioned it earlier in this Q&A. Uh, and so when you play back the Q&A once it's posted, and you'll hear my thoughts on that. Not to belabor the point, but in essence, Turkey isn't bad. It's just that there are clinics that know what they're doing and ones that don't. And as long as you are able to do your research and go to a good place, then you should be fine. But, the scary thing is when people, fall prey to a clinic that isn't doing things properly, and then they go back to their country and there's little that they can do after a bad job was done. But that doesn't mean, Turkey doesn't produce nice results. It sure does. There's certain clinics that are great. My mom had a friend that has alopecia, and she said that her hair didn't grow back. Sure, yeah, Jesse. Well, my hair doesn't grow back, so there are certain alopecias that don't grow hair back, and others that sometimes do. So just kind of depends on the clinical scenario. Wow. Oh, okay. So anonymous donated. I guess this is not U.S. dollars. It's 500 Thai dollars. Thank you. Yeah, that's awesome. I saw 500. I was like, "Oh," but that's still amazing. Thank you so much. What do you think when we can expect a cure for hair loss, like unlimited amount of hairs? Yeah, so like, yes, right. There are companies in Japan specifically doing some clinical research and trying to do human studies. No one knows is the answer. It's going to be very expensive, hair cloning early on, very expensive to even do the trials, like hundreds of thousands of dollars per patient. And then who knows how it's going to work? Just because it's worked on mice or pigs doesn't mean it's going to work well in humans. So we'll see. I have no idea. At all the conferences, they always say 5 years. Everything's always 5 years away until 5 years comes along, and we're still 5 years away. So we don't know, Lucas. It's a good question. Catherine, I have alopecia universalis. Oh, another one. Nice to meet you. After taking drug called alitretinoin, and I now have dry eyes every morning. Do you have any eye problems? How do you deal with it? I've been okay when it comes to eyes. Over the last week, ironically, with that question, I've noticed like having to blink a little extra. Maybe they are feeling a little dry, but I haven't really faced that up until like a week ago. So just like artificial tears is what I use when they feel dry. But yeah, that's definitely something that can occur because we don't have eyelashes. So for sure. All right, so maybe you can come up with a topic so subscribers can ask questions surrounding that topic, rather than you trying to answer everybody random questions. Uh, that's an interesting thought, aim. But the thing is, people come here for different reasons. So I don't think it has to be very topic focused. I'm happy to field whatever, and you just hear my responses. And if there are things I want to skip, I'll skip it. But yeah, no, I think it's all good. Like the best, if you have specific questions, well, first of all, people can always email us. We're getting a little inundated with just general questions in our main email address for the practice, but consult if it's something very specific to your situation and you want like a customized answer from me, the best thing to do is just to set up a consultation. That's the proper way to do it. For hair, some people just send us pictures, or for other things too, I'll give like a little bit of feedback on that, but it's going to be brief. And then you can always ask questions on our videos that are specific to certain topics. We try to get back to people. Of course, we can't answer every comment. I mean, it's just there aren't enough of us to do that. Definitely not enough of me, but we try. I had a hair transplant 9 days ago. Can you speak on how we know the hair is permanent after 10 days? Um, there's not much at this time point. You have to wait 4 to 6 months for the new hairs to start to sprout, and hopefully they do. All right. So if someone had diffuse thinning but no recession of the hairline, is this still likely androgenic alopecia? Not necessarily. So it could be. It could be. It's still the most common type of hair loss, but there are other types of conditions that can cause some diffuse thinning, but it most likely still is involved in some form or another. Bosley, it's fine. It's not about Bosley is just the name of a clinic. It's like as if I took City Facial Plastics and franchised it and said, City Facial Plastics does a lot of hair transplants and we're great for hair. Uh, but like, what doctor is doing it? Who are the technicians? How are they managed? Those are the questions people need to be asking. It's not about the name of the clinic or the chain of clinics. Doesn't make it good or bad. It's like who the doctor is who's actually doing your surgery. That's what you need to know. Soothing voice. Thank you. Appreciate that. Dangers of getting ribs removed. You mean like for rhinoplasty, Pippi? Long term, not too many risks. I mean, there's always the risk of like chronic pain, but that's not common. Short term, you can get a pneumothorax, hemothorax, and that is not good. But and there's pain, of course, associated with that type of donor site. But generally, people do okay if it's done by an experienced surgeon who regularly, routinely does rib harvest. If you keep plucking, tweezing hair in the same place, will that change how it grows back? Yeah, I mean, eventually it's going to burn out and usually not grow back. That's the most common scenario. Nizoral helpful in stopping hair loss? To some degree. It's an antifungal. It can be useful if you use it like once to twice a week. If you have, say, like seborrheic dermatitis, it's not for everybody. So there's some conditions where people get some improvement for their hair, and it could help with hair loss to some degree, but it's not like a medication that I routinely prescribe. But for the right candidate, it could be a good adjunct. Your wife is so caring. It's important to rest. Yes, she is. I'm trying to take questions from some new people. What is the longest that a patient has had stability from finasteride as a monotherapy? I have seen people go for decades, rock solid, stable. Yes, it could help for many, many decades. I mean, for your whole life potentially, but you have to stay on it. And that's what sometimes trips people up. They're like, well, I don't want to stay on the same medication for my whole life. And I get that, right? It's not for everybody, but as long as you want to see that benefit, you need to be on it. I'm just going to drink a little tea. Why do I have full and long eyelashes but few and thin hair? Aren't they related? They can be related, but sometimes they're not related. The body does lots of weird things. So with my condition and the other person who has alopecia universalis in this group, she also experiences the eyelash loss. But like with just most hair loss conditions, they'll affect the scalp. They'll sometimes affect the eyebrows, but usually the eyelashes are spared. And I don't think anyone understands exactly why, but they're not always treated the same by the body. Jay Leia, thank you for the donation. Thank you, Anonymous. There was a hole on her forehead. Oh, okay. What else? Sorry, I'm just trying to pick out some questions here from new folks. David Harris, is there still no procedure or treatment to treat under eye skin? Think maybe they meant to say thick under eye skin. Thick skin, it depends what's causing the thickness. If it's extra skin that is redundant, laser therapy can help, like resurfacing of that skin to tighten it. Can be helpful. There is blepharoplasty, sometimes with a skin pinch excision, which I don't love because it can actually cause retraction of the lower lid. But there are treatments surgically and non-surgically. They don't work great. Sometimes, if it's just like dark circles, you can use some filler. It's got to be the right patient for it. And then there are like non-surgical laser treatments that can help. Some creams, but they don't usually do a whole lot. and then lower blepharoplasty. I mean, those are like the standard type of treatments. Fat transfer, plus minus fat transfer sometimes. Lucas, there's also a U.S. company called Stemson, unlimited amount of hair, San Diego. Okay, cool. Um, interview with the CEO. Yeah, maybe that's something to look into. Thank you. Let's see here. Danielle, can microneedling, derma rolling help with traction alopecia? Are there any good options? So, yes, it can help. The number one thing to do is to prevent. So, you want to stop the thing that caused the traction alopecia in the first place. A lot of people fail to do that, and then they continue to re injure their follicles. So, if you stop that, you can definitely try some microneedling. I wouldn't do the dermal roller, but I would do like a doctor pen or a stamping type of device. That would be better. Merch idea: shirts with hairy city man, hairy city woman, or just less problematic hairy city person. Okay. Okay, yeah, maybe. We have a few sweatshirts. Well, one main design, but a few colors, and it's almost ready to go as far as selling them. So that hopefully within a week to 2 weeks, it'll be available, and we'll let you guys know. And then, we can always play around with other designs and other things like that. One thing that my team and I really want to work on is a scar gel, so we are going to be working on that. Um, look pretty hardcore to try to figure out a way to bring you guys something that is the quality of, say, like a biocorneum, or like, which is in some ways a gold standard in our field, at least from a surgical standpoint, because it's more pure silicone. Um, but at a more affordable price, but still something that's a good product. And so we think that there's space there in the market for that. Um, and yeah, because like Mederma, which is what a lot of people use over the counter, it has a ton of additives in it. And some of my patients come back and they have these like allergic, hypersensitive reactions. So they get all like red and itchy. So I think it's those additives that are causing that. And so we just need a more pure type of silicone product that's still great, that's not just sold through doctors' offices. So it's more readily available for people. So that is coming eventually. So if you guys have any feedback on scar gels, let us know and we'll try to incorporate that. But that's something our team really wants to pursue. Um, beyond just like merchandise and stuff like that. And then I'm sure we'll do other things too, but those are just some ideas. What else? Let's see here. Yeah, we'll do another 5 minutes. We've raised $120, so let's keep it going. We'll go to $150. Let's get us there, and then we'll call it a night. Someone's saying hi to Liz. Thank you. Someone just had a hair transplant. All the hairs have fallen out 3 weeks later. That sounds okay. There's not much to do at this point. You just have to wait. You could do a PRP treatment, but it's unlikely to do a whole lot more than what the surgery already did. So I would just wait until 4 to 6 months. You should hopefully see the hair grow in. Favorite surgery to perform? I don't really have a very like a one favorite surgery. I love all the things I do. Like I said in the beginning of this Q&A, are things that I love, and so I love them all. It's like, how do you pick your favorite child? I don't know. They're all good. Um, any tips to improve telogen effluvium? I lost weight in the last few months. Diabetes. Could this be a trigger? Yeah, sure. Yeah, the medical condition of diabetes could be a trigger. Weight loss could be a trigger. You could consider PRP treatments, microneedling, those types of things to help bring back the hair quicker. Why is it important to stop minoxidil and finasteride right before a hair transplant? So there's no reason to stop finasteride unless you're doing if we're talking about topical minoxidil, which is the most common type, even though I prescribe oral for a lot of my patients. But if you're talking about topical minoxidil and finasteride, And why you should stop that prior to a hair transplant. That's just because you don't want to be introducing stuff. I mean, this minoxidil, finasteride, they're chemicals, but they have a delivery sort of mechanism that's allowing them to kind of get into the this into under under the scalp and to your follicles, and so that can introduce some variables when it comes to surgical wound healing. So we try to eliminate those variables. If you're talking about like oral, especially finasteride, you don't have to stop that. No reason to stop. Michael donated. Thank you so much. Your videos have been helpful. Thank you. Appreciate that. Is taking oral minoxidil and oral finasteride at the same time risky? Spencer is asking. In my experience, no. And also just the general kind of hair transplant, hair restoration clinics out there that are doing this. No, I usually recommend taking one in the morning, one in the evening. I mean, they work in totally different ways, so haven't had a problem with that. How long is this surgery for hair transplant? Long, much longer than what people think. They can take all day. Depends on the size of the case, but if it's like a sizable case, big scalp case, it'll take all day, 10 hours, plus sometimes. Just depends, but we stay as long as we need to get the job done. You don't want it to take too long either, because then your follicles, your grafts are just sitting there outside of the body for too long. So you want to be expeditious, but you also want to do a good, safe job. Hair cloning, is it something not realistic? Yeah, I think it might happen. We just don't know when. That's the thing. People ask when. I have no idea when, but I hope it happens. And then it'd be great to have an unlimited source of hair. Do you speak Ukrainian? No, I don't. I speak Russian, conversational Russian, because my family's from the former Soviet Union. Hello, Dr. Gary. Is it possible to remove unwanted hair and reshape beard with FUE? Yeah, I mean, depends where you're talking about removing it from. So if you mean like unwanted hair from the beard, so like let's say the neck, we do use that as a donor supply, sometimes for the beard and sometimes for the scalp. So yeah, sometimes it's an option. What else? Let's skip around here. Triga, thank you for the donation. Mederma, okay, so here's, okay. Mederma Advanced Scar Gel Cream Treatment. This has very good reviews. Is it okay to recommend? I mentioned this a little earlier, and Mederma has some additives in it that can cause hypersensitivity in patients. So I've had many patients actually who've come back because they have a lot of redness and itching by the scar, and they've been using Mederma. So we switched them off of Mederma and onto something, for example, called Biocornium, and they do much better. Oh, thanks, Belle from Oslo. Thank you. The TV show Doctors had an episode where they removed blood veins from the outside eye corner. What do you think of that? Don't you need those veins? You don't necessarily need those veins, but again, they have to just be removed safely if they're going to be removed. ACE, well, depends which clinic. If you're asking about our clinic, our wait time right now is about 5 months for a consultation. Yeah, I wish it wasn't that far out, and we'll do our best to try to look at the schedule and see where we can add more people on. But remember, my surgeries take a long time. It's not like some other types of surgeries that are out there that are not on the face or the scalp that are quicker surgeries. My surgeries tend to take a while, and so there are massive blocks of time for surgery on my schedule where I can't be doing consults. All right, let's keep going. Trigger says, someone at work asked me if I was going through cancer treatment. I took my hat off and said, no, it's just alopecia, luckily. Yeah, I get that a lot, but just, most of the time people they're not trying to hurt your feelings. They just don't know. So that's the first thing that comes to mind. And if anything, they might be worried about you and care for you. So I think a lot of this comes down to perception. And then, of course, there are always people that look to hurt people's feelings, and we don't like those. So, anthropomorphosis, thank you for the donation. That's really kind. Awesome. And then you guys can also donate, after this live is done and we've posted the Q&A. People can go and they can still donate. So I think we haven't even, I don't think we set a goal for this one. Uh, but, whatever comes. I mean, this is for a great cause. The money's going directly to the Leukemia and Lymphoma Society, directly from YouTube. But it doesn't come through us at all, and we keep zero of it. So it's for a great cause. And anytime we do any type of merch, I mean, there's going to be a percentage that's going to go to charity always. So that's just, yeah, I think, expected and the right thing to do. What else? Skinuva Scar Cream is pretty good. $70-$80. Will yours be cheaper? I don't know. I mean, I'm not sure where we'll price ours at, but Skinuva, I'll look into that one and see. But I think that there is definitely room on the market for something that's high quality and yet a little bit more affordable. Anonymous, thank you for the donation. That's very nice. I live in New York City, and I know if I ever want cosmetic surgery, I'll go to you. LOL. Thank you. Pee pee poo poo. That's the name. Kind of a funny username. Um, what else? Wow, if you could make a more affordable silicone scar gel, that would be amazing. Yeah, I mean, I think it's about affordability and I think it's about quality, right? For me, everything I do is about quality. The initial sweatshirts, by the way, we're just trying to get something out there just because people have been asking, and we don't know if anyone's going to really care or want to buy them. And so we're just going with, like, I think it's called Printify and Shopify is what was recommended to us. So if it takes off and people really want, more, maybe we'll then try to find a place where, like, the quality of the actual material is like top notch and all that, but that would also drive up the price. So I don't know how much people are willing to pay. So we'll see about, like, that same analogy for scar gels. If the scar gel, if it ends up being really expensive to manufacture a high quality scar gel, then I guess the price will have to be not, the price of Mederma. I just don't know. I don't know. We'll have to talk to different factories and figure that part out. But I think it'd be interesting to experiment with scar gels that maybe even go beyond just the silicone, but also maybe include some things that are not going to cause sensitivity, hypersensitivity, but that might still help with further wound healing. And that's something else to experiment with. So we'll see. But I think there's a lot of promise there. Vegan, my sister survived lymphoma for 17 years. That's fantastic. Congratulations to her. Really happy to hear that. Bob, your surgeries must be pretty expensive since they take so much of your time, which you have to charge for. Yeah, I mean, we don't charge top dollar relative to, like, Manhattan prices. Just, I don't know. I mean, I'd like to be accessible, and I love that people can travel from all over to see me, and some people have to save up to see me, and that means a lot. I don't want to just be treating rich people, but it is surely not cheap. We are in the heart of Manhattan, in a fairly expensive location, and so there are lots of expenses, so we need to cover that and still turn a profit, or else it's not much of a business. So there are those elements, but we try not to be ridiculous. I mean, there's a guy here in town in Manhattan who charges $80,000 for the basic facelift. If you want to add on eyelid surgery or a lip lift, it's gonna be up from that, and that's one surgery. So yeah, it can get a little ridiculous here. And then I know another practice for hair, they just charge everyone $25,000, even if it's like a small hair procedure. So that's also not, I think, the most fair thing. But I guess maybe, I don't know, who knows? Maybe in 20 years I'll have a different view on it. And also, like, it's kind of crazy. We're scheduling out 5 to 6 months now. I mean, what is it going to be in 5 years? I guess I'll have to hire an associate of some kind. But look, these are good problems. I'm very grateful that people are trusting us. I think at a minimum, people know that I'll do the right thing, and that I'll be honest with them. And I think that we've established that through this channel. And I'm really grateful to all of you for allowing this channel to grow, which has been a beautiful thing to watch and experience and be a part of. And we're going to keep growing it because there aren't enough people like giving out honest, like, information, and just speaking the truth, like not trying to sell it. I think you can do good work and you can have a successful, and that's what I think proven at a minimum to myself and hopefully to everyone out there. But you can be an honest person, still make money and have a successful practice, and not try to like sell someone on something, but really just show them the value, or just talk about it. And if it makes sense for them, then great. If it doesn't, then at least you learned something. That's honestly how I feel about the whole thing. So we're getting there. 134. Any more donations? Let's get this to $150, and I'll call it a night. Um, let's see. What country are you in? Actually, I can't donate in this region. We're in the United States, but I didn't know not every place can donate. Let's see. Uh, okay. What else? What else? A lot of the same folks commenting. Anyone new want to jump in? All right. All right, guys. It's been great. Oh, wondering if you would ever take a sponsorship. We do have one coming up, but it's a product that I already use for hair surgery. So when they reached out to ask if we wanted to talk about them in an upcoming video, it was a no-brainer. The deal was I get some credit with their company for the product that I already buy. I'm not going to ruin it, but you'll see what I'm talking about. It's a great product. It's kind of one of a kind, and we use it for most hair transplants, not all, but most of our hair transplants. So yeah, so that you'll see coming up very soon. But in general, we turn down almost every sponsorship because I don't want to be like bought by a company. I want to speak my mind and do what I want to do, and tell you guys the truth, and uh, and not favor one thing over another just because someone paid me some money for it. So that's how it goes. Anonymous got us there. Look at that. $155. Awesome. Um, Thank you guys. This is great. And that you're welcome, Steve. Anonymity, thank you very much. Yeah, no, thanks, guys. Yeah, I mean, it's like a simple formula, right? To me, it's like it's who I am. So it feels like a no-brainer, and I'm so glad that it's resonating with you guys, because it's like I feel like everyone should do this, whether you're like a plumber, a car mechanic, like just get on YouTube and speak the truth, and don't try to screw people out of like money or like convince them to do something that they don't need. Just do the right thing. I mean, it's just like so obvious, and yet somehow it seems like a novel idea. So great. Well, thank you guys so much, and happy holidays to everyone. We will be posting more on YouTube, on our Instagram. I have a whole strategy planned out for TikTok, but I need to get my new camera installed into the room next door to mine that we're outfitting for the new year. And the only part that I'm missing, everything else is compiled in St. Louis with the guy who integrated all the parts. But the only part missing is this one boom like arm thing that the camera will attach to. But once I have that, we're going to be doing some really cool point of view surgical videos, and that's going to be big strategy for TikTok, and I think the TikTok channel will then take off. For now, we've kind of stopped posting on there because I'm not going to be dancing, and and the before and after stuff doesn't really work well on that platform. So the point of view surgery stuff I think will be really really cool, and we'll do voiceovers and other interesting things. It won't just be like bloody surgery. So yeah, so I'm excited for that, but that's probably going to be like February, March, that we'll do that. So, and look at that, I stay on here longer, and now we're up to $175 raised for Leukemia and Lymphoma Society. Just so cool. And the next fundraiser is going to be most likely the a dachshund rescue that is the place where we got our dog, and so we really want to raise some money for them. And I don't think they were in YouTube as like an option to choose for charity, so we had to like add them in, but that's coming. Natalia wants to wait until 200, but you see, I gotta listen to Liz. Liz is back there telling me like wrap it up. It's time to call it a night. So great. Someone just gave another donation. Thanks, Anonymous. 195. We're so close. We're so close. Ketoconazole shampoo, I already spoke about earlier, so you can rewatch the live and you'll see it there. But yeah, good night, everybody, and hope you all enjoy the holidays and the new year. And I'll probably do another one of these in 2021. Really have a lot of fun talking to you guys. So, and there we have it, Anonymous coming up big, $200. Great. Thanks, guys. Have a good night. Thanks for joining me, and we'll talk again soon.